Assalamualaikum warahmatullahi wabarakatuh. In this occasion, we will discuss about ascariasis. So let's start the discussions. The first, we will discuss about the etiology and epidemiology. So ascariasis caused by Ascaris lumbricoides, which is the large nematode or roundworm that infect the human gastrointestinal tract. The adult female up to 20 until 35 centimeters, while the males are 15 until 30 centimeters. For the another species, there is Ascarism, which infects pigs, may occasionally infect humans too. And for the geographical distributions, the worms have worldwide distributions, but most common in tropical and subtropical areas, which still has poor sanitation and feces still used as the soil fertilizer. And how about the disease? People who infected with the Ascaris often show no symptoms. If symptoms occur, they can be light and include only abdominal discomfort. For the heavy infection, it can cause the intestinal blockage and impair growth in children. The other symptoms, such as cough, are due to the migrations of the worms through the body, sometimes occur too. For the ascariasis, it is treatable with the medications prescribed by the health provider. And how about the transmissions? The transmissions of this disease occurs mainly via ingestions of water or food, which is such as raw vegetables or fruits in particular, and it is contaminated with Ascaris lumbricoides eggs. And occasionally inhalations of contaminated dust or children playing in contaminated soil may acquire the parasite from their hands, and enhanced by the fact that individual can be asymptomatically infected and continues to shed eggs for years. For the pathogenesis, there are two phases in ascariasis. The first one is the blood-lung migration phase of the larva. So in person repeatedly infected with Ascaris and sensitized to parasite antigens, the migrating larva may lead to inflammatory and hypersensitivity reactions in the lung. There is formations of granuloma and eosinophilic infiltrates. It leads to fever, cough, dyspnea, urticarial rash, and eosinophilia. The sputum may be blood-stained and may contain Ascaris larvae and charcot-laden crystals. This condition is known as Leber syndrome. Allergic inflammatory reactions to migrating larvae may involve other organs, such as liver and also kidneys. Larvae and adult Ascaris lumbricoides secrete allergens, which can cause hypersensitivity reaction in hosts. The second is the intestinal phase of the adults. So adult worms produce various pathological lesions in the following ways. The first is mechanical actions, the second spoliative actions, and the third is allergic reactions. So the initial phase consists of the severity of intestinal disease depend upon the worm, load of the intestine, and nutritional status of the host. The presence of few adult worms in the lumen of the small intestine usually produces no symptom but may give rise to fault abdominal pains or intermittent colic, especially in children. Heavy infection with a large number of worms can cause impairment of host nutrition and growth retardation in children. Heavy worm load, especially in younger children, may lead to intussuscitions and partial or total intestinal obstructions. Wandering adults may block the appendicular lumen or the common bile duct and even perforate the intestinal wall. And how about the clinical signs? The incubation period is variable because the parasite life cycle may take 4 until 8 weeks to be completed. The signs and symptoms of the nematode infections by Ascaris lumbricoides may include the following: abdominal discomfort and abdominal cramping, abdominal swelling, which is especially in the children, fever, coughing or wheezing, nausea and vomiting, until sometimes passing roundworms in their eggs and the eggs in the stool. And for the diagnosis, healthcare providers easily diagnose infections by examining the stool sample from the patient using a microscope to identify the Ascaris eggs. In some instances, stool particles are concentrated to increase the likelihood of finding the nematode eggs. Other tests that suggest infections include the blood tests that show eosinophilia, or the wide increased presence of a certain type of white blood cell, and also abdominal X-ray or ultrasound studies that may detect a large mass of worms in the intestine. And how about the treatment? So fortunately, there are some medications to the treatment of these diseases, such as the albendazole, mebendazole, and other drugs also such as ivermectin, levamisole, pyrantel pamoate, nitazoxanide, and piperazine citrate. And also for the case of pregnant women, the drug is pyrantel pamoate only, because the other drugs like mebendazole and albendazole may cause teratogenic effects in the fetus. Once diagnosed, primary care physicians treat most of patients. However, if complications like bowel blockage or intestinal perforation occur, other doctors such as surgeons, infectious disease specialists may need to be consulted. Other severe complications can involve the lung and may require a lung specialist or pulmonologist to be consulted too. And there are some complications of the disease such as bowel obstruction, pancreatitis, cholecystis, peritonitis, and etc. And the last, it is also can result in death. So the other organs other than the intestinal tract and lung also may be involved. In some patients may have allergic reactions that may become severe, and about 11,000 deaths occur each year worldwide due to the intestinal obstructions caused by ascariasis, with the majority of patients being children. And this is the prevention and control. The best way to prevent people from getting ascariasis. The first is avoiding ingesting soil that may be contaminated with human or pig feces, that including where human fecal matter, wastewater, or pig manure is used by fertilized crops. Wash hands with soap and water before handling food, after touching or handling pigs, and etc. And also it's also important to teach children about the importance of washing hands, and also the transmissions of Ascaris lumbricoides infections to others in community setting can be prevented by not defecating outdoors, and also effective sewage disposal system. So that's all my presentations. I believe this can be useful for us. Wassalamualaikum warahmatullahi wabarakatuh.